Welcome back to Main Street Living, ladies. We've had a great show so far, and it's going to continue. Ain't that right? Well, ain't that right? That's horrible English, isn't that?
That's
Isn't
okay.
that right?
Of course it's going to continue. We
It's
have
hard.
lots more great stories to bring you.
It's hard to talk right now, right? It's hard for all of us to kind of preserve our mental health right now, our physical health. But it can be especially challenging for people that are dealing with opioid recovery, that type of thing. So joining us now, the CEO of CODAC Behavioral Healthcare, we have Linda Hurley. Linda, thank you so much for joining us on Main Street.
Well, thank you for having me.
So Linda, tell me, how can you ensure the health and safety of your community at CODAC?
Small question. Well, we're doing a number of things as our other community behavioral health care providers, because we're faced with two challenges. We know, number one, that isolation is very often the enemy of healing. So when people are suffering from substance use disorder, opioid use disorder, other behavioral health care problems, isolation is probably the last thing that any of us would need. So we know we need to address that in this era of, sheltering in place and self-quarantining. At the same time, we have to lower the risk of exposure for the folks that come to us for care and for our communities. So what CODAC has done, along with many others in the community, is that we're providing increased services and contact, but we're doing it via telehealth and telephonic services. So we're decreasing the amount of individuals that come into a space and share an environment, but at the same time, we're reaching out more and providing more voice-to-voice support,
Sure.
if you will.
That's what I was going to ask you is how are you guys able to evaluate and to treat patients virtually?
Well, we have the capability of telehealth, which is, basically using the system that we're using now or one similar, and with our physicians and our medical department. And then for case management services, check-ins, crisis, if someone just needs to speak to someone they know or someone they know cares, then the telephonic works beautifully. Which is just telephonic's just a big word for calling somebody up on the phone.
Sure. So. It's great that we have access to the technology, right? But it's like it's not a replacement for the personal contact.
It is not a replacement for personal contact. However, when it comes for treatment and care and support for healing from these various diseases that we're talking about in behavioral health care, what a lot of the research has shown, what the literature states, is that the telephonic component of telemedicine is actually viewed as effective or more effective by those receiving the care. That does not mean that support in recovery and our support groups and our family support and the support of our friends can occur that way as effectively as well. It doesn't mean that.
Absolutely. I think we can all relate to that right now. We're all like, can't wait to get back and hug our family members.
True.
Speaking of families, what can family members do if they have somebody in their family that is struggling with opioid addiction or something of that nature? What can they do to support them at this time?
I think it's dependent upon the situation, but support is contact. So if someone lives with you that's struggling, then having the conversation, giving them space, allowing them to feel their discomfort and be with you is exactly what someone would need. They also need the support of others in the recovery community, whatever that might look like, whether it's 12-step or other forms of recovery support. There are actually on CODAC's website, there's a list of links where individuals can go for recovery support groups in the community, in the state and national ones. But we put that up a while back because it's very important. And you got to love Zoom, right? There are Zoom meetings all over the place now, and they're wonderful for individuals.
Of course. Well, thank you so much, Linda. I was just going to ask you where people can get more info. So make sure you check out CODAC's website, especially at a time like this. I know it's a cause that affects a lot of people. I think we all know somebody who's been affected by something like this. So we really appreciate all the work you guys are doing. And thank you for joining us.
Oh, thank you for having me. I appreciate it.
Of course. Thank you, Linda.